You can see it, I can see it. We're living in a care crisis. Whether it's in our NHS, our childcare, social care, disability care, trans health care, or our welfare state, people simply aren't accessing the care they need. Our systems are failing, and fast. Around 1 in 6 people in Britain are over the age of 65. In the next 20 years, that'll rise to 1 in 4. As our population grows older, the crisis in care is becoming more apparent. We simply don't have the infrastructure in place to make sure that we and our loved ones can age with dignity and autonomy. What little care is available is unaffordable for most. The UK has the 3rd most expensive childcare in the world, costing 1/3 of an average family's income, compared to just 1% in Germany. And across England last year, 79 elderly people died every single day while waiting for care. So people are stepping in where the system fails. According to Carers UK, 1 in 5 of us now provide care for a loved one, and 12,000 new people are becoming unpaid carers each day. As the cost of living crisis intensifies, an increasingly precarious sandwich generation is caught between caring for elderly relatives and looking after children, all while working full-time jobs. It's simply not sustainable. And every time there's a report that looks into this crisis, its findings are ignored. Whether it's in the hospital or in the home, we aren't getting the care we need, and workers are left overworked and underpaid. While they clap, 1/4 of all unpaid carers haven't had a day off in 5 years. And with an hourly rate of just over £10 for many domestic support workers, paid carers won't be going on holiday anytime soon either. This is a systemic crisis of willful neglect. Our mental health is suffering, our physical health is suffering, and it's spilling out into all other areas of life. This care crisis cannot continue.
It may not seem like it, but care is big business in Britain. Even though our systems are woefully inadequate, the last 50 years have seen a boom in paid care work. Between 2017 and 2027, over half of all job growth in the UK is set to be in sectors like education, healthcare, and cleaning. Across developed countries, care jobs now employ around 1/4 of the total workforce. If we once spoke of manufacturing powerhouses, today we have care economies. But if care is the fastest growing sector of our economy, why does nobody seem to be getting the support they need? Let's look at the money for a second. Since the pandemic, you can't seem to turn on your TV screens without hearing someone's solution to the care crisis. With the NHS on its knees, corporations have inserted themselves into the gaps created by over a decade of austerity. This has made a lot of people very rich. In 2021, Britain's largest care home operator paid one of its directors £600,000, despite posting £83 million of losses in the same year. And what's more, the state is still coughing up to keep this whole racket going. Half of the residential care sector's annual income of £15 billion comes from public money. Despite rising costs and ballooning bonuses, waiting times are getting longer and the quality of care is getting worse. Something doesn't add up. While £1.5 billion goes to landlords, shareholders, directors, and creditors with offshore accounts, one area where costs are being cut is labour. Across care sectors, employee churn is high, wages are low, and zero-hour contracts common. Venture capital companies are bringing gig-like conditions to the sector, all hoping to be the next Uber of care. With insecure working conditions and lack of protections, our care workers are being left on the sharpest edge of the cost of living crisis. Whether you're working in it, using it, or having to step in when it falls short, the corporate care system is failing us all.
In the 1970s, a group of feminist organizers began an international campaign to name and combat the exploitation of unpaid and underpaid care workers. Their demand? Wages for housework. Their point was simple. There are no workers without care. There are no profits without care. There is no society without care. Wages for housework was a provocation. It forced us to see care and the other forms of unpaid labor done in the home for what it really is, work, and hard work at that. They asked, who are you talking about when you talk about the working class? What work is considered valuable and why? And what would capitalism be without the labor of love that keeps it all going? For a worker to labor in a factory, they need food, shelter, medicine, and countless other things to be provided for them. That's social reproduction. And more often than not, that means women's work. In the West, social reproduction has been imagined differently at different historical moments. We've gone from elites and their servants to the nuclear family, to both parents working, caring, and taking on massive debts to keep their household afloat. In all these systems, we are told that care is something that ought to be performed not for money, but out of love. But this is still work. Work that is gendered, unpaid, underpaid, and exploited. At a conservative estimate, informal, unpaid care work in the UK is valued at nearly £400 billion annually. Even though today, much more care may be carried out as a job for a wage and for profit, the core problem of exploitation and inequality remains. As upper and middle class women have increasingly entered professional industries, care has been outsourced to low-wage, precarious, and often migrant women. So once again, it's the invisible heart, not the invisible hand, that keeps capitalism running. Wages for housework was a radical intervention in its time, but the questions it posed remain relevant today. What if care was not treated as external to the economy, but as its very purpose? What if, instead of growing profit, we nurtured and grew people? And not just to become workers, but to enjoy our full potential in a life beyond work.
We're in a dangerous moment when it comes to the politics of care. In the middle of a cost of living crisis, in the wake of a pandemic, and faced with climate collapse, right-wing populists are exploiting the prospect of scarcity. Care for your own, care for the nation, and care for people who look like you. Those on the outside are scapegoats, and hard boundaries are being drawn between those who deserve care and those who don't. To tackle this, we need an expansive vision of what it means to create a care-based economy. Obviously, it starts with short-term spending to stabilise our failing systems, so high-quality care is available to everyone. We need £1.8 billion to close the childcare funding gap in Britain, and between £6 and £14 billion for social care. That's a drop in the ocean compared to the nearly £50 billion our government spends on the military each year. And of course, we need to properly fund our NHS at every stage of life. But this crisis is both global and systemic, and it requires more than just a short-term fix. As the Wages for Housework campaign taught us, valuing care properly means dismantling the social stereotypes and gender roles that push unpaid and underpaid care labour onto the shoulders of women, particularly women of colour. Care is everyone's responsibility. So what we need are caring systems, not just caring people. This means addressing issues we don't traditionally think of as being care-related. From the privatisation of our basic services to the shackles of global debt and the violence of policing and border regimes, our economy today enriches a small number of people at the cost of the global majority's basic care needs. Instead of GDP or the stock market dictating the health of our economy, we need to build a system that centres people and the planet. This is essential now more than ever. As we stare down the barrel of climate breakdown, We need to protect those on the front line of crisis, regardless of race, class, gender or geography. This is an opportunity to rethink our institutions, to rewire society so we can look after ourselves and one another. But changing the principles on which our economy is based requires more than policy tweaks. It's about reclaiming and redistributing power so that working class people get to decide how we work, why we work, and what we value.
In 1975, women in Iceland went on strike from both their day jobs and their domestic responsibilities. Organised by women's councils across the country, the strike saw some 25,000 women in the streets of Reykjavik alone. The country's gaps in pay and education became among the smallest in the world. The Icelandic strike was wages for housework in action, an internationalist, anti-capitalist revolt of the caring classes. By focusing on women's unpaid labour inside the home, childcare, cleaning, sex, even emotional support, activists exposed the fundamental inequalities at the heart of our economy. Inequalities based on an idea of the nuclear family that leaves some people overstretched and exhausted, while others are excluded altogether. But refusing exploitation is only the start. The strike was also about building a better world, a world in which the gendered division of work is abolished, and where nobody falls through the gaps of care networks that are already hanging on by a thread. The possibilities for a care-centred economy are endless. Take Denmark, where high-quality childcare is guaranteed, or Finland's universal school meals. There's the visions of public luxury built in Vienna in the 1920s, or even the 10 subsidised canteens of our Parliament in Westminster, but made available for all. We could learn from Cuba's New Families Code, that recognises the lived pluralities of genders and multiple family structures, that extends the state benefits so often reserved for blood or marriage to all those linked by caring relationships. And it could mean following Chile's proposed constitution that would have enshrined a right to care from birth to death and the right to free time for all. But this is also an opportunity to break new ground, to demand a reduction in working time and a shorter working week, to harness the potential of technology to actually help care workers rather than exploit them, and to build new spaces distinct from home and hospital, creating the social infrastructure for us all to heal and unwind. A future in which care is collectivised could be a future in which time itself is reclaimed. At its heart, creating a caring economy requires a democratic rethink of how we choose to live and relate to one another and the world. From the depths of a care crisis, now is the time to find the spark to not only revolutionise care, but to fight for a caring revolution.